Welcome to the Dietologist Pre-Op Information. What a great way to prepare for your surgery by going through this information now. Preparing for surgery. Now, before you actually have weight loss surgery, you will need to follow a pre-op diet. You'll also know it as the LRD, liver reduction diet. Now, most people will need to follow it for 2 weeks. Some people will actually need to follow it for a little bit longer. So it all depends on your BMI. Some countries abroad may say that you don't need to worry about a pre-op diet. I really disagree. If you don't shrink your liver, what's going to happen in theatres is that they're going to pump more gas into you to inflate that area. The more gas that you have pumped into that cavity, the more pain you're going to have after surgery, and you are going to probably take longer to recover. So all your medications will need to be crushable, chewable, or in a liquid format from the day you have surgery. And it's usually for about 6 weeks. Now, some surgeons, the guidance is slightly different. They may say 4 weeks, but on average in the UK, we advise 6 weeks. So you might be thinking, why? Well, we don't want tablets sitting in your stomach pouch for too long because they can really upset the stomach. So if they are crushed or they're chewable or they're in liquid format, they're going to be absorbed a lot quickly. They're not going to be sitting around in your stomach pouch, and they will not have the opportunity to upset your stomach. So you will need to see your GP to see if you can get all your medications in this type of format. Now, you can use a pill crusher or 2 spoons, which is what I generally use when I've got to crush any medication. Or you can go and see your pharmacist and ask them which medications are available in a crushable, chewable, or liquid format. Now, if you have diabetes, there's information that you need to know about, because when you go on the pre-op diet, it's going to be quite low in carb. So if you are on insulin, you will need to reduce your insulin levels to accommodate the reduction in carbs in your diet. And this will help prevent the risk of low blood sugars whilst you are on the pre-op diet. So you must liaise with your GP or diabetes nurse when you start your pre-op diet.
Why it's important to follow a pre-op diet. Now, the main reason for following a pre-op diet is 1, to ensure you lose a bit of weight before you have surgery, and 2, to ensure your liver shrinks, because the liver sits in front of the stomach, and because your surgery is performed laparoscopically, that means keyhole, we need to ensure the liver can be lifted so the surgeon can access your stomach. Now, many centres abroad may ask you not to follow a pre-op diet, or they may allow you to have a large meal the night before your surgery. Now, I completely disagree with this advice. Every patient having weight loss surgery should ideally follow a LRD diet, a pre-op diet, to help shrink the liver, because the liver stores something called glycogen, and that fills the stomach. And for those people that are struggling with their weight and having weight loss surgery will have larger livers. So it needs to shrink. Now, if you follow a pre-op diet and then decide to have a large meal or that final supper or that food funeral the night before your surgery, well, I'll tell you what's going to happen. Your liver is going to inflate back to its normal size, and there would have been no point in you doing that liver shrinkage diet. So my advice is that you follow a pre-op diet, may it be 2 weeks or longer, depending on your BMI, and you avoid a large meal the night before your surgery.
So for most, the pre-op diet will be for 2 weeks. You need to make sure you spread your food and drink out over the day. So don't have it all in the morning or in the evening. Make sure you're having your 3 small meals and your fluids. The calorie intake is around 800 to 1,000 calories per day. You need to make sure you're drinking plenty of fluids, and that includes low-calorie fluids. And you can actually have diet fizzy drinks at this stage, but you can't have them post-surgery. Make sure you drink at regular intervals to make sure you stay hydrated. It's safe to take sweeteners pre-surgery and post. Remember, I would start taking your multivitamin mineral daily at this stage, and make sure you keep mobile and busy and active, because we want to use up your glycogen stores, which are stored in your liver. I advise my clients to go on to liquids only the day before their surgery to ensure the stomach is empty for the next day. I actually recommend that most of your diet, your pre-op diet, your liver reduction diet is made up of proper food. And I'll tell you why. Because you're going to be on liquids only for 2 weeks after the surgery, and you're going to be gagging to chew food at that point if you've been on liquids solely pre-surgery. The night before your surgery, don't go having your food funeral or a large meal, because if you do, your liver will inflate back to its normal size. Now, some of you aren't going to listen to me, and you're going to be hell-bent on following a liquid pre-op diet. So I felt I had to include this in my pre-op information. Now, you can make up your pre-op diet with 3 to 4 meal replacements, things like my protein meal replacement blends, then Fast Vitality or Keto, the supermarket's own brand of meal replacements, Exante diet, etc. You can use whatever you like. Each product will probably have about 250 calories and around 15 to 25 grams of protein. Now, you might decide, especially if you're diabetic, that you might choose to have 2 meal replacements and 2 to 3 protein shakes. Now, the difference here is the protein shakes will be low in carbs, low in calories, but high in protein. Now, the combined diet might be the easier option, where you have a combination of meal replacements and a light meal, a bit of fruit, and a diet yogurt. So here's an example of a combined diet where you have 2 meal replacements and a light meal, which is 350 to 400 calories. You can also make up your 350 to 400 calorie meal using a medium plate and having about 4 ounces of cooked meat or fish, half a plate of vegetables, and just a couple of new boiled potatoes or a couple of tablespoons of cooked rice and pasta. And that will generally work out around a 350 to a 400 calorie meal. Now, if you start to add sauces, then the calorie intake will go up. So just be mindful of that. Just follow a real food diet where you have a maximum of 100 grams of carbs. The calories are between 800 and 1,000 calories. And I'm not going to go through this because you can put yourself a meal plan together. But I've also done this for you. So I'm not going to go through this information because you can go through this in your own time.